So every year the Industry Skills Council produces an e-scan, and for the last 5 years in that e-scan, aged care leaders have said they really need some development because of the complexity of the change. So the Industry Skills Council, along with AXA and LASER, the two aged care peak bodies, AXA and LASER, we went to the Department of Industry with a business case, and the premise of the business case was that capable leadership was absolutely vital for the sustainability of the aged care industry moving forward. And we were very fortunate that the department agreed with us, and so they gave us a bit of money for a project to do an analysis and to consult with as many people across aged care to work out how to go about developing leaders in our industry. So we had 2 years. It started in June 2012. Where we established the project, and we made a grand aim that we wanted to consult with as many people across the industry as we possibly could in the time frame. So we also set up a project network. So if anyone is interested, ever since we started the project, we invite people to join the project and be part of the network. It just means you get updated on what's been happening. Sometimes you can provide feedback on different areas, but it's a great way to keep up to date. We ran focus groups in rural remote regions. We did in-depth interviews. We sat alongside leaders for a day. We did conference presentations. We actually started with a 6-month consultation period and we extended it to 8 because we said there is so much more to learn, so we decided to extend the consultation period. And now we're in the design and development stage, and so in response to the consultation, we've developed a strategy paper. And a way of getting a copy of the strategy paper is to join the network, and you just drop me an email if you would like my email. Thank you. Would you like one as well? Yeah.
Thank you so much.
So you get a copy of the strategy paper, and what I'm talking about today is really an executive summary of the strategy. Okay, so we're also developing a capability framework, which I can give you a copy of today. We're going to have a development guide, and we're also creating an aged care leadership development portal that you can go to for all the information. What it's meant, because we've extended consultation, we extended the development, we've pushed our implementation stage into a really short time frame. But the great thing is that in actual fact, what the project's established is actually a whole strategy for the future. So I'm very confident that what you'll see is AXA and LASER leading this into the future, and there'll be plenty more activity. I know that I was at a planning meeting yesterday with the committee, and they're already talking about the next plan for the next year. So what is the vision for aged care leadership development? So it's about raising the profile of leaders and leadership in aged care. So many of the leaders in aged care felt very undervalued and very unrecognised. They also felt like the poor cousins of health. So we felt that in developing leaders, we wanted to change that, and we wanted to raise your profile. We want to lift the confidence, capacity, flexibility and adaptability. Now these are words from aged care leaders. So you can see why one training program is never going to achieve those sort of things. But what aged care leaders said were really helpful was mentoring, communities of practice, being able to work alongside some other leaders, grappling with similar issues, which is what we see through WIN. They're the things that have really helped them develop leadership capability. Informing, guiding and planning and decision making. So if we are talking about more holistic development, then we need a way of helping you do that really quickly and easily and cost effectively, and making a tangible difference. Making a tangible and positive contribution to the broader recognition of the profession and value of the sector as a whole. And really, in essence, the way I explain this is in the media, we want to see the great stories rather than the stuff that we're seeing recently. That's really what we're aiming to achieve. So what did we get out? Our consultation taught us a lot about leadership capability in aged care. And we learned that there's a mixture of management and leadership capability required to be a really effective leader. And the sort of management capabilities that people talked about were along these lines around delegation, monitoring, accountability. Think about the regulation, you can see why they're really essential capabilities, but they really are in that management space. But people also talked about those leadership capabilities around influence, strategic thinking. Think about, the changes we're navigating, motivation, innovation. With aged care leaders, you are leading not just your employees and new business. You're actually leading people in the community. You're leading many families grappling with their person that they're caring for that is ageing, and often you're also leading government thinking. But we also found that there were capabilities that sat between the two, that were essentially leadership but also had a real management mix in there. And the reason why I mention this is because this is one of the reasons why we decided to create an aged care unique leadership capability framework, because we felt these capabilities couldn't be found in any other framework we looked at. So we made a decision to develop a unique one for aged care. And the thing about the capability framework was as well that in aged care, what we had to do is prioritise the development of people responsible for managing others. That was really important. And so, but the leadership capabilities were different depending on what level of manager you were. So there's level 3 managers and they manage like smaller teams. Level 2 managers, they're sort of managing multiple teams, multiple services, general manager, but sometimes team leaders I've come across in that sort of role. Then we have the level 1 leaders, and they'd be CEOs, board members. A lot of boards are quite involved in aged care, management of aged care services. But also I found there were some general managers that were managing quite big, complex community, rural, remote areas, and were not a CEO but general manager, and I can see that they sort of fitted into that level 1. So this image here on a page is the strategy on a page, and people talk about systems thinking a lot. Well, this is our application of systems thinking for you. What we do is we show how a holistic approach to leadership development is required and how every piece is connected to another, and it's actually like a development pathway as well. What we're creating with the project is we've created we have created a capability framework. Please take a copy. Mark, do you want one? Yes. So the capability framework is which is developed specifically for aged care leaders and underpins all the development that happens of aged care leaders. So whilst there's a whole lot of different development activities, that can be the common reference point for all of that development. There'll be an aged care leadership development centre. Remember I was saying how we needed it to make it really easy for you to navigate. There's a recommendation. So what AXA and Laser are doing, they're creating an aged care leadership development centre, and it'll be virtual. So there'll be a portal created as a first step, and that portal will be where you can go to get anything that's been produced by the project, connect up with the network, link up with other leaders who are looking at similar, maybe trying to develop a new service or along those lines. Diagnostic tools are an important part of this. Many aged care leaders that I spoke to had been in the industry for 40 years and never received any feedback ever. And so they said, we'd really like a way of getting some feedback, but a constructive feedback about our leadership capability. So we're developing a self-review diagnostic and also a 360 diagnostic. But combined with that, it's all about the debriefing and about having appropriately skilled mentors that can help you get that feedback and align it to maybe some development needs that are important to you as an individual, because that's a really important part of the process. There's a companion guide that we're going to develop that can help you use the capability framework for a number of different purposes as well. So there'll be things like job design. You can use this to job design for a new management position or leadership role. You can use it for attraction, how you do job ads. You can use it for recruitment. You can use that to write your questions in recruitment and interview questions. You can use it to design an appraisal process. And I've even got an organisation here today who's already done that, who's used our capability framework to design an appraisal process for all managers in their organisation. You can use it for succession planning. So you can see how to develop leaders from level 3, if we think about our ageing workforce, You're thinking 10 years, how many of us are no longer going to be here? So we've got to think about, well, what's that development pathway for those emerging leaders and how are we going to do that? So there'll be some guidance around development, succession planning and how you go about that using the capability framework. So you'll have them available. Now the next steps for the project, and this is what AXA and Laser are leading, is we need to develop these 3 levels of leadership development programs. I want to avoid, it's a hard one because you won't see training written here anywhere. What you see is workshops, you see roundtables, you see peer networks. So what we've got to do is we're working on, well, how do we actually fund the development of this? And obviously there will be an industry co-contribution. You'll still need to pay for people to participate. But what we're working out is how do we use economies of scale? By having an industry approach, how do we get economies of scale so that when we get these programs developed, we can negotiate on price to make sure it's very affordable. So how am I going? This is my 5th or 6th time around. So we've got the capability framework. We've got that companion guide. That's the guide that shows you all those 5 different areas. We're going to have the online portal. We're going to run some workshops. Not many though, because we really run out of money, like you do. Unless you just want to fly me over, I'm happy to. You can fly, you don't have to pay for me. That's if Rod still wants to pay for me. But we're going to record our webinars. So what we thought was, it might be a bit too much of a stretch. So we record a whole lot of webinars. And a lot of people will tell me today, look, that's useful too, because I can just watch it when I've got time. And a lot of people that have English as a second language, they like recorded webinars because they like to watch it a couple of times. It helps. So thank you for listening to me. And I hope it's... Join the network, won't you? Thank you. Thank you.